Hey everyone. Today's interview, today's conversation is going to be about digital twins. It might be about discussing the future of pharmacy and how things are going. So if you're a pharmacist, if you are in medical affairs and you're trying to figure out how to connect with pharmacists, you probably care about today's discussion. Our guest today is someone we've had on a few different times, but he's always such a pleasure to have on. He's the president of Cassian RX. He's a thought leader on specialty pharmacy digital strategy and helps specialty pharmacies position themselves for the next generation of patient services. We've had him on a few times. I'll try to put a few links in the YouTube description about some of the chats we've had with him before. And our guest for today, Collin Wolf. Hey, Collin, how are you?
Hey, Darshan, how are you?
It's good. Just want to emphasize to everyone, this is a Darshan Talks live stream in case you can't tell from all the branding around it. What we do want is please ask our guest questions. Please leave a comment, please subscribe, please hit the bell icon, please share. It helps with the YouTube algorithm. You can always find me on Twitter at DarshanTalks. Go to my website at DarshanTalks.com. You can actually find Collin at CassianRx.com, or you can actually find him via email at Collin, that's COLLIN .wolf at CassianRx.com. And he will actually be exhibiting at NASP in Orlando. So, Collin, awesome. Thank you for coming on again.
Yeah, thanks for pointing out the two L's. I think even my closest friends get that wrong. And anyone in the audience, please interrupt me while I'm talking. That's always a good sign. And I will stop whatever I'm saying and try to answer whatever questions you have. So that's always the preferred way of going here. So thanks.
I agree. And if you have questions afterwards, feel free to reach out to him directly. And I know he'd appreciate that. So Collin, let's talk a little bit about something I noticed on your website. You actually said that you guys work and deal with digital twins. That sounds like, how should I put this? It sounds scary. And it sounds like that's a horrible thing that is someone cloning me online.
We are. We've actually captured all of your consciousness, and as we talk, I'm making a better model. But
a better version of me.
A better version of you, so all of your ancestors can talk to the better version.
It's like Black Panther, just better.
Right. Yeah.
I don't know if you saw that scene from where all the ancestors got together and they were talking in Black Panther.
Right.
Okay.
But yeah. So when we're talking about digital twin, I think really what we're trying to do is help a lot of people in specialty pharmacy, regular pharmacy, and even folks in the manufacturer and health system side, because there's a very consistent problem when we're talking to specialty pharmacies, which is the entire process that they've spent a painstaking amount of time developing, refining, implementing, testing with their patients to see how their specialty pharmacy is going to perform. When they interface with someone like a Cassian who's looking to deliver digital patient services, their first instinct is, oh no, everything that we've been developing, all of our internal processes, everything that we've been designing over the past 5 years, if we turn on this texting service or this patient support interface that's going to personalize towards them, we're going to lose all of our internal special stuff, right? And the next thing is, we need you, Collin, to not lose our internal special stuff. And the only way we can think about expressing that is through the somewhat modern or perhaps somewhat scary term of a digital twin, right? And if we think about a digital twin, that's taking a real physical thing in the real world and then creating the digital half of that real thing. And so when we're thinking about a specialty pharmacy, what's the real thing? It's a way a prescription flows through the specialty pharmacy, right? So the first moment the script hits the pharmacy, we have a complement of that in the digital realm, right? So the patient gets their welcome packet, they get initiated in the pharmacy, they get a customized, on one perhaps even video from the pharmacy to say, your script has just entered us. Welcome. We're pleased to have you. Here's what we do next together. Does that make sense?
Sort of. And I'm still trying to position that. How is that different from just a walkthrough, if you will? What makes it a digital twin? I guess I'm still lost with that.
Yeah, and the digital twin part is speaking to many times digital services that represent a specialty pharmacy are unhinged from what's actually happening in the specialty pharmacy. And so what we're doing is we have a series of triggers at each point of when that prescription moves through the pharmacy that not only communicates to Cassian what just occurred. So if we think about it, there's the welcome packet, there's the first fill, there's the welcome tour, there's the clinical assessments, and then there's the refills, right? So at each one of these points, not only are we pulling that data element, but when the patient completes that digitally, we're pushing that back in the system. And so each one of these steps, we have a one-to-one map sequence. To take it one step further, many times if you have a digital patient service, I think the title of this podcast is enabling ROI, right? Getting to ROI via digital twin. If you don't have this mapped, once again, exactly to the drug, then the refill requirements, perhaps if we're doing like a REMS type workflow, if we're doing a infusion type medication, you have to real time change these refill requirements, the clinical assessments, the portal experience itself to map exactly to what the pharmacist needs on their end to then enable it to happen. And what we've seen so far is almost every single existing service doesn't really get that right. The pharmacist still has to call the patient, and then that ROI is not realized because you're not saving time.
So what I'm hearing you say, and please correct me if I'm wrong, if I'm misunderstanding, what you're saying is what you're doing is mapping the patient journey behind the scenes, all digitally done. And the result of it is that the patient has a seamless experience because the pharmacist is not required to intervene each time. And that results in better pharmacist output and better results and ROI for the pharmaceutical company as well. Is that accurate?
Correct. And I think one of the things that's also very important to hit on, and again, this is like the first level of all this, right? Which is most existing systems then require the pharmacist to press the button to say, I just moved it in the queue and now Bing, text the patient to tell them that it's on the way. We're trying to eliminate all of that extra work to say, when that happens, Cassian doesn't have to do anything. Your pharmacist doesn't have to do anything. We're configured so that just automatically, boop, it's out. And the patient knows exactly what happens when it happens without any intervention from the pharmacist.
So what you're talking about is creating and improving the patient experience. Is that fair?
Yep.
So we have a question from Lydia. Could you ask Collin to do a nutshell version of how he as a pharmacist got involved in online pharmacy services and how to improve the experience?
Lydia, thanks for asking. So one of the first specialty pharmacy experiences that I had, and perhaps you can relate to this, first I was doing MTM services, and my quota for the day was getting 100 outbound phone calls. And then for each one of these phone calls, I was entering typing in little text boxes and doing all that kind of stuff. And I would get yelled at by patients. And they're like, why are you calling me? Who are you? What is this? Like, I didn't ask to be called like this. And then experience number 2, it was on the clinical side, right? So I was doing Hep C assessments for patients that were on therapy. So every week, the manufacturer had a requirement that we should call the patients once they were initiated on Hep C therapy. And it's extremely important work. And many times patients, they wouldn't know who I was. They wouldn't recognize the phone number of their own pharmacy that they were getting expensive medications from. They wouldn't recognize a lot of the, even the questions or the name of their medication. And so while we were doing this, I was thinking this really, yes, we're pharmacy, we're pharmacists, but we're trained to do clinical work. We're trained to intervene and recognize patient issues as they occur, address them, and move on. And most of the time that we were spending was spent informing that, yes, this is your pharmacy. Do you have time for questions? And I really thought that this is a technology problem that you're paying a pharmacist to sit behind the window to do. And with that understanding, I became passionate about solving these problems with technology to enable pharmacists and the care team to do what they're trained to do, to unlock that time. And that's how we got started.
So it's interesting. What I'm hearing you say is that the reason you got into this journey was because of what you saw as wasted time by pharmacists that didn't improve the patient experience. If anything, it detracted from the patient experience. Not because the pharmacists were bad or the patients were bad or even the pharmaceutical company was bad. It was that lack of communication. And what Cassian is doing is trying to address that lack of communication. Lydia, by the way, does say thumbs up, so that's awesome. Wait, could you do the thumbs up again? Because I think your thumb got cut off.
I'll put it in front of my body. There you go.
There you go. So what you went into doing with Cassian was trying to address that I have no idea who you are question by saying, well, I have a way of solving that. What I will do is I will automate some of these services. The result of that was the first version of what you're calling a digital twin right now. I've seen the term digital twin thrown around more in the pharma space, where they're saying, what if we landed up doing clinical trials and we don't actually use a human being, we use synthetic data to create human beings online and test on them and the result of it. You've actually said, yes, that's just the testing. Why don't we actually try that in person? How are companies reacting to this messaging? How are people seeing and understanding what you're putting out there? Because you're addressing the experience, not just the data.
Yeah, and before I get to that, I'll say one thing is when it comes to, I was just kind of reacting to how you summarize the how did Collin get into digital things. I would never say that it's a waste of a person's time to tell a patient who they are, right? And I think if it's a 10-minute phone call and I'm your pharmacist and I have to take care of you, and the most we get out of that conversation is I'm your pharmacist and I'm here to take care of you, and they didn't know I was there before that, I think that's time well spent, right? But I would rather have a technology take care of that piece as time well spent, and then me do the thing that I'm trained to do. But you're spot on, right? So in clinical trials, it's what if we had ways to abstract endpoints and then figure them out virtually. And we've started with the operations side of specialty pharmacy, right? The next step that we're taking in the space is what are the few pieces that we can learn about a patient so that moving forward, we can predict when that patient's going to drop off therapy, what challenges they're going to have, and et cetera, and then implement the right message before it happens, right? And some of these really easy things is risk stratification and then real-time models then that reach out to the patient. So you think about there's your red lights, your yellow lights, the green lights in the most simple risk stratified scenario. And then you can risk stratify multiple groups, which is, are you having trouble accessing your medications? Are you having trouble getting to your appointments? Are you having trouble paying for your medications, right? And then so there's like, how much of a problem is that for you? And then are you a red light, yellow light, green light? If you're a green light, you don't want to hear from me more than once a month. I don't want to talk to you either. If you're a yellow light, you might want to have some more back and forth with Cassian. If you're a red light, then it's intervention time, right? The next thing is this is actually your question, which took me a long time to get to. How are people responding to the digital twin side of things? I think similar to when we started Cassian, we're like, hey, let's introduce digital, especially pharmacies. People weren't ready for that conversation. It took them a few years to have that. Right now, it's what is digital twin, especially pharmacy? Let's talk about it. I think in the VC space, folks are ready for that conversation. Pharmacists themselves, they're like, this sounds interesting, or maybe it sounds scary. We don't really know yet. We'll figure it out. But hopefully, I think it's kind of the right message for the time that we're in, which is people are looking for customized service and not just out of the box tools that don't do what they have to do.
Which is really interesting, right? What you said is you are, as you put it in your own description, you're trying to address the patient experience. You're interested in sort of taking that next step to look at where's that next generation of patient services going. Do you find that you are in your role trying to drag people to where they should be going, as opposed to people being comfortable where they are? And how do you balance that struggle of, I'm comfortable, I don't want to change my life, and you going, but we can be better? And what does
Yeah.
that look like?
Yeah, I would say when we started, again, if we're talking 2018, if I'm saying let's talk about digital pharmacy, it was no, my patients are too old. They don't know how to use their cell phone. How many people do you treat that's over 50? Like, show me where it's at. Since the pandemic, since COVID, the conversation has flipped entirely. It's we need digital. It's how or when. And I think even on the patient side, I think pharmacies are seeing a demand, and it's real, from patients, since you have other services like Amazon kind of that have led the way. Even like my airline, if I fly Spirit down to Florida, they got me covered. And I know folks don't like Spirit, but they've got it all figured out too, right? And so I think people have come to expect this from their pharmacies, and then pharmacists are saying, we need to offer this. And I think the thing that's been missing when we started, that people are on tune with now, is this can actually save you a lot of time and help you do more, right? Not only it's not just about offering a patient a service that they want, but it's how can we use this to help free up your time to spend more time on the clinical side of things too. So it's double win. Yeah.
So who is your audience? Is it pharmacists or is it companies?
So there's a few, like, from my perspective, one, usually the clinical pharmacy team, the operations team, they recognize this is a problem. They're interfacing with patients real time. But then, of course, we need to talk strategy at the highest level with the C-suite to make sure that it fits in their pharmacy strategy and they can work with a Cassian, right? Because when we're talking about digital twin services, we have to have everything mapped one-to-one. And I think almost 100% of the pharmacies that we've talked to, I'll walk that back. I'll say 80% of the pharmacies that we've talked to have in the past tried to implement a service that didn't address what they were looking for because it couldn't mimic what they're doing at the pharmacy level. They kind of, the digital service played over here, and then they're playing over here, and then something got lost. And so half of our challenge is talking to the pharmacy team and saying, here's how we're going to do it differently, and we're not going to burn you like the past service that you were playing with.
So what I'm hearing you say is that there is an ideal pharmacy, there's a size at which this starts making sense, because I can't see your regular one individual mom and pop pharmacy being able to afford or be part of this. What is that magic number where it starts making sense because you're doing the volume and the types of patients, the more complicated patients, who might justify a Cassian-like service?
Yeah, so we've seen things all over the map. I would say generally from an ROI perspective, it would be 3,000 patients per month or greater. And then sometimes, but I think it depends on like what kind of game the pharmacy is playing, right? If we're talking specialty light, or it's things like on the close to the retail side, they're not going to be doing a lot of the patient outreach that they would need to then use up a lot of their pharmacy resources, right? Sometimes there's pharmacies that are in a hiring pinch, and we saw that the job market go all crazy earlier in the year and last year. And then we have that conversation, right? But generally, if we're talking specialty programs, we're talking things like on the LDD side, if we're talking things where there's more frequent patient outreach and a high clinical touch, then I think that's a right fit for us. And especially if the pharmacy wants to deploy something that is unique for each one of their patients over time, right? That's something that customizes to their patients as opposed to a general service. Something else that is a very, I would say, strong sweet spot for a Cassian is if it's not only one pharmacy, but multiple pharmacies under the same umbrella, right? And then what we do is imagine there's like one system with like 6 unique pharmacies beneath it. Each pharmacy can have its own branding, its own clinical content, its own, you know, everything is kind of custom to that one individual pharmacy, but then all the data can kind of boil up, and we don't have to have 6 unique deployments. We kind of have everything customized and modularized so that you can do like the white label multi-site kind of thing. And that's a really strong sweet spot for us, because the C-suite and the executive team is like, phew, instead of buying this 6 times, we only had to buy it once.
Right.
Right.
So Lydia actually comes out and she says, to me, what Collin Wolf is saying is he wants to use technology to create a digital experience that is as efficient, smooth, and pleasant as the person's ideal personal pharmacy experience with a real pharmacist. Do you think that, so this is the fear that all pharmacists, first of all, is she accurate?
I would say so. I think there are things that, in my mind, I want to use a pharmacist's brain to the utmost degree for what the pharmacy part of the brain is. And I want to offload all things digital, like what are my resources for this drug? What are the hours of your pharmacy? What are all the things that a pharmacist would pick up the phone and say, I wish I didn't have to answer that, right? That can all be taken care of via Cassian and all the personalized resources. But generally, I think Lydia's got it spot on.
But then that's the interesting question, right? So the more you outsource, should pharmacists coming out of pharmacy schools right now be worried that their job is being digitized to digital pharmacists and to digital patients?
I would say no. I think the fun part about the Cassian service is, for all these little programs and all the things that we figured out for all the refill workflows and all this stuff, is there's this flagging component. So really it's like, let's get rid of the first call and just get you straight to what the patient's issues are every time, right? And then you're on the trail, right? It's like, okay, this patient, according to the REMS requirement, they were supposed to be adherent to this protocol, but Cassian figured out they're not, right? That's the time to shine as a pharmacist, as opposed to asking 10 million screening questions. It's all, how many pills do you have on hand? 30. Okay. And then you're just like checking boxes. What if we showed you the actual problem the first time, right?
So what you did is you saw the problem up front. You were a pharmacist. You were doing those MTM services up front, and you saw this problem. My question to you then is, what was that experience like to go from, I see a problem, no one's trying to solve it, it's time to jump in, it's time to solve this problem? And were you afraid? Because I'm thinking of every pharmacy student coming out right now who's saying, I don't want to be in retail, where you're saying, no, we can improve the retail experience. But for those people who are saying, maybe I do or do not want to do the retail experience, you're now also pointing out a whole new pathway for pharmacists, where you're saying you can be in the digital world, you can be changing things for patients and for other pharmacists. So in your experience, using the skills you've learned, could you talk about your journey being an entrepreneur? Does that make sense?
Yeah. And I think so when we started, I think I called every specialty pharmacy in America. I went online and I went New Jersey, specialty pharmacy. And then I got 50. And then I went Pennsylvania, specialty pharmacy. I got 300, right? You just keep going down and down and down and down. And then at the end of that, the question is, it's not like, yes, it's asking what problems do you have, but then once you have the problem validated, you quickly have to go to how much would you pay for this? And then you say, okay, it's yours, it's done. Will you buy it for the price that you said? And then it's, oh, no, right? And then it's like, well, why? And it's like, well, because my pharmacists don't know how to use it. Right. Or we have to integrate it, right? And then you actually get to the real problem, which is, okay, we have to not only figure out how to help patients, but we have to help figure out how to enable pharmacists to use this in their workflow without having 1, 2, 3, 4 screens because, it's like, okay, we started off and we have the dispensing software. And then it's like, oh no, we have to be, especially pharmacy now. Let's get a clinical management tool in here. And it's, oh no, we have to have a digital service. Let's get this third thing that we kind of check sometimes, right? So we have to think about, okay, the pharmacies understand exactly what their pharmacists are capable of doing. We have to figure out how to implement these services in workflow. And that then becomes the majority of the thing that you're working on developing. And then you spend a lot of time fixing that core problem, which is how do you enable the teams to actually use your stuff as opposed to deploying it, if that makes sense.
It does. So what you're talking about is you went through the process of identifying the problem before you actually started creation, or was it after you did the creation, now you're validating that your problem was right?
I think we were, I would call it neck and neck, right? So we always had something to then demo and show and say, we think your problem is this, is your problem this? And they would say, no. Right. And then the thing that, like, once you go through all this validation process, like, it turns out that compliance, security, right? All these boring words that this is why you're here, right?
Thank you. Yeah, for all the boring words. That's exactly what I'm here for.
Compliance, security, like all these things that you would not want to be working on as an entrepreneur, they become like half of your product.
Right.
And you're like, okay, like that's actually a lot more than we thought we had to do in this domain. But once you have it all figured out, then that's like a very, very sizable amount of the thing that you're working on. And then your product is a lesser percent of the whole pie, but it's still the necessary piece, right?
So you said I have this identified as the core problem. Would you like to buy it? No. I kind of want A prime. Oh, great. We can make A prime. We're going to make A prime. You're going to buy it now? They go, what I meant was A prime plus. Okay, A prime plus. We got this.
Yeah.
How many iterations did you go through before you said, yeah, you know what? This is the product. Like I've seen Steve Jobs, for example, at one point. I say seen, like I haven't actually met him, or never actually met him, but seen Steve Jobs say at a certain point, you've got to tell the customer the problem you're solving, and that's what they're buying. Because if you let the customer dictate it, you'll never get to the end. And essentially, like one of the jokes I've heard is a camel is a horse built by consensus. So at a certain point, you go, this is all I have. So how did you decide that you were done?
We're not done. No, I wish I could agree with Steve Jobs here, but I think, and that's kind of why we went with the digital twin strategy, right? Because if we were done, every pharmacy would be the same, right? Okay. And so we're consistently working towards meeting each pharmacy is unique because they have their own clinical workflow. They have their own system they have to integrate into. They have their own special thing that makes them unique and who they are. And if we were to finish, basically it's like dot it and be like, done. And then we get a phone call and they would say, okay, our pharmacists stopped using your stuff because it didn't actually do the whole infusion workflow that we have, where we have to ship all these medications to these infusion sites. And then the delivery dates are wrong. And you sent the medications on Memorial Day, and don't you know everyone's out partying, right? And you have to, each pharmacy has their own little lane, and just how these pharmacies are set up with their own tediousness. I think there's the whole digital side of things that have their own thing there. What I would say is the process. We figured out a process that's I would say almost basically done and figured out and fleshed out for how to work with the pharmacy.
When did you know that you figured out the process?
I would say one, process is still improving, right? And we understand like what the steps are, but two, having onboarded a few pharmacies in different groups, right? Where we have, here's basically the mapped out patient journey between onboarding documents, welcome packets, refills, clinical assessments, retention tactics, et cetera. you basically have buckets for each one of those items where the clinical assessments, here's the flow of how you figure out all the clinical assessments. Here's how you map them to all the pharmacies, NDCs. Once you have the NDCs figured out, then that populates all the documents and the personalization. They're on out, right?
Yeah.
And you just kind of work in that stepwise manner. But I don't know, maybe we're going to be surprised with another pharmacy that has an extra step, right? And I think that's where we want to be, is we want to be the group where if you're a little bit different, you don't have to be afraid of working with us, and we can grow with you. I think that's kind of both of our key things right now. Yeah.
And I appreciate that, because like I mentioned to you, Collin, I'm trying to launch 2 pieces of software, one of which is a contract builder. And I've come up with like, this is a semi-customized version and this is an alpha build, but I'm trying to go, okay, at what point do I go, at least for the alpha build? I recognize it'll keep changing, but here's where we are right now. And constantly you're getting feedback going, well, you need to target this audience, or you need to add this component in there. And you're kind of always struggling with, okay, can I bring this out? And what I'm hearing you saying is you will never be done, accept that part of it, launch, keep fixing continuously. The solution is not get it perfect. The solution is get it right and then keep improving. And that's what I'm hearing.
Yeah, there's a really, you remind me of a really funny example where I think it was some of the first people who made those DVD boxes outside of the grocery stores. You know what I'm talking about? Like, if you go to a grocery store, like there's like the thing where you can like
Redbox.
Rent the box.
Redbox? Yeah, okay.
And there's a very similar process to that where they're like, we have this idea, but we don't know if it's going to work and people are going to buy it. So they literally put an empty box and they painted the front right. And then they had like, maybe like it was like a screen that they controlled from like some back end. And they literally went inside the box.
Did they really?
Yeah. And they pretended like once they pressed the button for like what movie they wanted, they would like take the money and then they would put the DVD out the front. Right. And then, so basically what I'm suggesting is you're Darshan, right? You are a lawyer, and find, I would maybe like a cohort of 10 people where it's, you've signed up for this service, and then whatever you don't have, I'm going to figure out real time on the spot. Right. And then once you do that like 5-10 times, then you're going to say consistently, this is the part that is standardized and I can just kind of chunk out to everyone. But it seems like everyone is having a problem with data rights.
Sure.
And data rights has to be unique to them.
Yeah.
Or everyone's having a problem with when the billables are received. Right. And that has to be, so that I would say the sooner you can have someone where they're on board with saying like, I'm going to pilot this with you, but the sooner, and you kind of get started. Right. And it goes twice as long and twice as expensive as you wanted it to. And then you're like, why did I do this? Right. But then you have something figured out that you can actually, then you can figure out like what's standard and what has to be modified.
On those super smart words, we're going to start calling it, but a couple of things before we go. Can you remind everyone how they can reach you?
Yes, that's my email, collin.wolf@CassianRx. I check double L. Thank you. I check our inbox on the site very, very frequently. So if you have any questions, you can go there. I put like 5 to 8 little like talk to us buttons. So I'm sure you'll find one. That covers it.
Or you can go to the website at CassianRx.com.
Go to the website. Yeah, for sure.
And what would your parting words be?
Thanks for having me. And let's hang out in Philly soon.
I'd like that very much. And again, I also want to add one more parting word, which was Lydia, thank you so much for writing in. That was actually super fun.
Yeah, thanks, Lydia.
Thanks, everyone.
Thanks.